do a present. Dr. Imran?
Hello.
Yes, hi. Is Ahava going to be speaking today?
You, I think, start first and I ask her first.
No, Ahava?
Hi, good morning.
There you are.
Doing already, I guess. Yes, I'm speaking. Are you speaking?
Yes, I will start and then I will introduce you.
Okay, sounds good. Amazing.
Awesome. Okay, let's get started. Hi, everyone. B. Coleman here. And as most of you know, I'm not a homeopath, but I am someone who is fanatical about learning all I can concerning natural medicine. Today, we are discussing GERD, also known as acid reflux. Today's modern medicine prescribes proton pump inhibitors in order to reduce stomach acid. And that is exactly the opposite of what is needed. Acid reflux is directly related to the stomach acid. However, it's not a question of volume. We hear about high or low stomach acid, but the amount or level of stomach acid has nothing to do with acid reflux. It is a matter of the strength of the stomach acid. Our stomach acid was designed to be strong enough to digest our food, but when it's too weak, it fails to do so. So if you put food into a stomach with weak stomach acid, it will sit there, and sometimes the food rots a little. It is the gases from this rotting process that backs up and comes out through the mouth. The result of this incomplete digestion is that the nutrients from the food eaten are not absorbed by the digestive system as the food continues its journey down the pipeline. This lack of nutrient absorption renders us malnourished. We may be taking in tons of calories, but we're still malnourished. And this begins to create all manner of health issues: gastric issues, hormonal issues, thyroid issues, skin issues, allergy issues, you name it. Here's another aspect of weak stomach acid. We all have parasites at some point or another, and also various other, we'll call them cooties, in our bodies that coexist with us without any problems. They reside further down the digestive system. Now, when our stomach acid is strong, it is able to keep these entities at bay. It keeps them from entering, crossing into and beyond the stomach. Weak stomach acid, however, allows these intruders to escape into the stomach and beyond, and leads to all manner of illnesses. So the first line of attack is to heal the gut. However, the resulting health issues, I believe, in order to heal faster, need to be addressed and corrected individually. Now, what I have had great success with among my family members is the first line of the Banerjee protocols. It has worked. I've used it basically for all my family members with varying degrees of low stomach acid, including my very, very young grandsons. One of them was 2 weeks old when we started him, because he was pretty much projectile vomiting his breast milk. So this I've never had to go beyond the first line protocol. It has worked fabulously. Now, the downside is that it takes a long time, for us at least, and we muscle test. So others may use the protocol, and when their symptoms subside, they stop. We don't stop until we stop muscle testing for it, because we don't want it to revisit us again at some later point. So what we have found is that it takes, in our family members at least, anywhere from 17 to 24 months. That is a long time. So you need a lot of consistency. You need patience. But the upside is it works beautifully. And it doesn't just suddenly work at the end of 17 or 24 months. It is slowly improving your digestive system throughout the entire time. And once you're done, you're done. Like I said, we've never had to go beyond the first line protocol. Now, this is the first line protocol. 1 dose of Iris versicolor 200. Now, they recommend liquids. My suspicion is you can go liquids or pellets. I've asked Helios, and they say it really doesn't matter. They work exactly the same way. So Iris versicolor 200 twice a day, and also 15 to 20 minutes before each meal. So I'm thinking 5 times a day. Most people are only able to achieve about 3 times a day, and that's fine. Just know that it's going to take you a little longer, and maybe that's why it took us the 17 to 24 months instead of a shorter period. The second remedy for the first line protocol is a dose of Lycopodium clav 30C twice a day. These two are not taken together, they are taken separately. For the second line protocol, you take a dose of Condorongo 30C twice a day. And the second remedy is Arsenicum album 3C twice a day, 15 minutes before lunch and dinner. Again, these are not taken together. And then finally, the third line protocol is a dose of Nat Phos. That's Nat Phos 30C twice a day. And as I said, this is a wonderful protocol. I've tried, we tried a couple of shorter ones along the way, and it seemed like the thing to do. It seemed exciting that we could get done a lot faster. But what I found is they didn't work quite as well. And we lost a lot of time, and then we still had to go back and finish up the first line protocol for the Banerjee protocols. So what I would say too is when you're treating your acid reflux, which has created some health issues for you, you also need to be treating the particular health issues. I know a lot of times there are food intolerances that people have. And what we do when we're doing the first line protocol is we also include a dose of Bovista 200 once every other day. And that is for allergies in general and for food intolerances. However, for a dairy intolerance specifically, we also, because one of my grandsons, no, 2 of them, had a milk intolerance. So what we did for that is I would put them on, oh my goodness, I've lost, what is it? Athusa. I did Athusa 10M twice a day, and we did that for several weeks, and that is to give it a huge jump start. Twice a day, Athusa 10M. And then we switched over to the Athusa 30C, which is what the Banerjees recommend. Athusa 30C twice a day. And that is all that I have for you. And so I now hand you over to Ahava. Ahava, go ahead.
Okay.
Okay,
Hi.
there you are. Okay.
I'm just logging, my video back on. Okay, so thank you so much for having me, Dr. Imran and B. I'm looking forward to hearing, Dr. Imran, what you have to say. Thank you, B, so much for your testimonials and what you do. Very thorough. Okay, so my name is Ahava McLaughlin. I am a traditional naturopath from South Florida, and I use homeopathy in my practice, but I'm not a classical homeopath. And I will just be sharing some tips on what to do for acid reflux today. Okay, so as B mentioned, there are a lot of the times, they sell the acid blockers on the market and they say, take this, but it actually leads to making the condition worse. And most people think that they have an overproduction of acid, right? Because they feel the acid coming up, but it's very rare. Actually, it's actually an issue of underproduction of stomach acid and rather than over production because there's a yeast overgrowth. Primarily, and also, like B mentioned, food intolerances, which stem from a leaky gut. So all that like put together causes the acid reflux. We need minerals like vitamin B6, B12, and sufficient stomach acid in order to absorb these minerals and vitamins. Silica, which supports bone, skin, and blood vessels, convert to orthosilic acid to be absorbed. So the presence of stomach acid increases the conversion of silica. So you could see here that this is highly critical and important for really assimilating and absorbing our nutrients from our foods, is to have good production of stomach acid. When it's out of balance, the overgrowth of yeast leads to heartburn, and due to the fermentation from the yeast, which then causes carbon dioxide, which is that bloating sensation. And so we need to focus on digestion. So betaine hydrochloric acid is one thing that you can try. Also taking digestive bitters with your food, papaya enzymes, for long term, and then sealing up the leaky gut. That is highly critical and important. A quick fix for in the moment is either apple cider vinegar and water, or even like a papaya enzyme, or taking 1 teaspoon of baking soda in 8 ounces of water, and that neutralizes that sensation and gives the relief that the person is looking for. Stress is also something that causes indigestion. When you get stressed, you get into that fight or flight type of pattern. And for some people, and a lot of people actually, it causes the stomach to get upset, right? It goes into the stomach. And so this can throw us off as well. Really knowing what your food allergies are is highly critical, or sensitivities even. And unfortunately, sometimes the blood tests and the prick tests aren't so accurate. I mean, it gives you a good idea, but it's not an 100% thing. So if you know how to muscle test or learn how to muscle test, this could be a very good way to find out, is what you're eating good for you? You could basically just hold the food up to your stomach and close your eyes and just say, is this good for me? And if your body sways, I mean, this is your standing up. So if your body sways forward, then that means it's a yes. If your body sways backwards, it's a no. Don't make it too much more complicated. It's very easy to do. And just basically, is this good for me? Is this not good for me? And your body will tell you. Sometimes it'll tell you no to an apple, but it could be because there's a lot of pesticides on that apple, so it'll say no. So it's obviously sometimes understanding that you might not have an allergy to the apple or sensitivity to the apple, but rather maybe some of the chemicals used to lengthen its life that might be causing that, and to protect it from bugs. Okay, I think that's it. Okay, do I have anything else? Nope. I think that's it for today. Thank you so much for having me. And Dr. Imran, I'm excited to hear what you have to say.
Thank you very much. Bismillahirrahmanirrahim. Good afternoon, everyone. Here is Dr. Imran from Pakistan. Today we are talk about the leaky gut and stomach related issues. Leaky gut syndrome is also known by the name of increased intestinal. It refers to a condition that arises as a result of improved functioning of intestine tight junction in the small intestines. The tight junction in the small intestines refer to a protein that lies in between the epithelial cells, lining that makes the gut barrier. Over the cells, a layer of mucus is also present. The tight junctions allows only selective transport of the nutrients and electrolytes into the bloodstream. Alongside, it acts as a barrier that protects the toxin microbes and undigested food particles present in the lumen of intestine from entering the bloodstream. Any damage to these tight junctions leads the substance, toxins, microbes, and undigested food particles to, to get into the bloodstream. As a result, and autoimmune activity start in the body participated by reaction with these substances leading to many disease conditions. These activities are started by our own immune system to counter these substances, considering them to be a foreign harmful matter. Few conditions and medicines may lead to leaky gut is widely accepted by but the evidence to support that leaky gut may lead to a significant disease conditions is very little. What are the cause and factors linked with triggering leaky gut syndrome? There is no specific single cause that can damage the gut barrier, this causing leaky gut syndrome. However, there are many conditions that damage the gut barrier. These majority include intake of antibiotic in excess high alcohol, consuming radiotherapy, type 1 diabetes, the stress and food sensitivities. Other factors include a compromised immunity, chemotherapy medicines, and overgrowth of yeast bacteria in the bowel. What are the symptoms and conditions that may arise from leaky gut syndrome? Leaky gut syndrome majority lead to gastric symptoms like bloated abdomen, abdominal cramps, diarrhea, constipation, increased skin allergies, joint pains, fatigue, migraines, and food allergies. Various medical conditions may arise in a person with leaky gut syndrome. Few of them are rheumatoid arthritis, lumps, disease, ulcerative colitis, eczema, psoriasis, asthma, irritable bowel syndrome, multiple sclerosis, and chronic fatigue syndrome. But leaky gut syndrome cause these conditions or just triggers them is still a question to be answered. Apart from above, it is also seen that many individuals having autism have leaky gut syndrome. However, it yet very unclear leaky gut syndrome in the cause of an effect of autism. So now we are talk about some homeopathic remedies for leaky gut syndrome. There is a great scope of treating leaky gut syndrome in homeopathy. The homeopathic system treats leaky gut syndrome effectively and is a very safe manner with natural medicines without any side effects. Homeopathic medicine aim to prevent further damage arising from the leaky gut as well as managing the symptoms of the leaky gut in an excellent manner. The homeopathic remedies selection for treating leaky gut syndrome internally depends on the body system affected and the symptoms arising therefore their form in every individual case. Few homeopathic remedies are given below that thought not specific from leaky gut but indicated majority as per the symptoms and the various conditions arising from leaky gut syndrome. The use of these remedies should be done under the consultation of homeopathic physician and medication should be avoided. So first remedy is colocynthis. Colocynthis is highly effective remedy for treating abdominal cramps in cases of leaky gut syndrome, slight eating or drinking rosin, the abdominal cramps. The cramps may be better by bending double in the most cases. In some cases, hard pressure on the abdomen makes that the person better apart from cramping. This medicine is also helpful for cutting, gripping pains felt in the abdomen. So we are use colocynthis in 30C, in 200C, and in 1 m according to the patient condition. So next remedy is China. Next remedy is China. China is a wonderful homeopathic remedy for abdominal bloating arising in the leaky gut syndrome. It is indicated when the whole abdomen is bloated, rumbling or moving of flutters is felt in the abdomen. Motion tend to release the bloating along with there is a heaviness and sensation of weight in the stomach after eating. There may be blinching of bitter taste of taste like that of food. China is also indicated when taking tea or fruits rosin the complaints. So we are used China in 6C, in 12C, in 30C and 200C according to the patient condition. So third remedy is Lycopodium. Lycopodium is significant homeopathic remedy for cases of leaky gut syndrome when increase of gas is a marked symptom. Lycopodium is indicated when is felt soon after eating even a small quantity of food. Also when there is a sensation of something moving up and down in the abdomen.
Yeah.
The flutters remains increased,
No, not.
obstructed most of the
Okay.
time.
Yeah.
So I request to everyone, please turn off the mic. A burning pain in the abdomen may arise from flutters. There are few food substances that tend to worsen the condition, including cabbage, beans. So we are used Lycopodium in 6C, Lycopodium in 12C, and Lycopodium 30C, Lycopodium 200C, and Lycopodium 1 m according to the patient condition. So fourth remedy is Nux vomica. Nux vomica is a homeopathic remedy for treating constipation in person with leaky gut syndrome. The symptom of using Nux vomica is constipation with constant infectual urging for stool, the person needing Naxomica tends to go for stool several times a day. Every time he passes a small quantity of stool, the urge to stool soon after the last evocation, an uneasy sensation in the rectum always parasitis. The stool is always insufficient, unsatisfactory, and always a never get done feeling is, is present. Rumbling and gargling in the abdomen may assist above feather. So, Naxomica we are common use in our clinical practice in 30C, in 200C, and 1M according to the patient condition. So, fifth remedy is Elusoc. Elusoc is a major homeopathic remedy for treating diarrhea arising from leaky gut syndrome. For Elios to be used, these symptoms may present
Nancy, would you please turn off your mic? Nancy,
sudden.
also iPhone 12 mini, would you please turn off your mic? Dr. Imran, would you repeat the remedy again, please?
Just a minute, I write the remedy name in comment box.
Thank you.
For stool after eating, the stool is thin and undigested. In most cases, before and during stool, cramping in the abdomen may be present. Sometimes much passes with stool. They tend to be offensive in nature. In few cases, mucus may pass in the stool. Eluse is one of the high-ranking homeopathic remedy for irritable bowel syndrome with diarrhea. So we are use this remedy in 30C and 200C according to the patient condition. So sixth remedy is graphitis. Graphitis is a helpful homeopathic remedy for treating skin complaints in leaky gut syndrome. It is indicated in both dry as well as discharging this discharge from the most sticky in nature. It is also indicated for dry rash with itching, rawness in the bands like the elbow, knee, and behind ears, also indicating points to use graphitis. The skin complaint like eczema and or psoriasis are treated well with homeopathic remedy. So graphitis we are using 30C, 200C, 1M according to the patient condition. So seventh remedy is Restox. Seventh remedy is Restox for joint pains in leaky gut syndrome. Restox is an important homeopathic remedy for treating joint pain in leaky gut syndrome. Restox can be very beneficial in the cases of rheumatoid arthritis, is linked to leaky gut. For stocks to be used any of the body joints may be involved. Person needing Restox may get relief in joint pain by warm applications. Massage over the affected joint may also alive another feather for Restox to be used in that there is marked of the joint pain or rest and relief from arm motions. We are used stocks in Mertenture, stocks 1x, 2x, 3x, stocks 30C, 200C, 1M, 10M, 50M, according to the patient condition. So, 8 remedy is belladonna. Belladonna, medicine for headache, migraine in leaky gut syndrome. Belladonna is a valuable homeopathic remedy for headache, migraines in person with leaky gut syndrome. For belladonna to use, the nature of headache is most time throbbing in nature, congestion and fullness sensation in the head is also noted. There are few rousing factors of headache when belladonna is indicated. There include noise, cold air, light and journeying, pressure and tide bending are the major relieving factor for the headache. So we are use belladonna in 6C, 12C, 30C, 200C according to the patient condition. So ninth remedy is Califas. Califas, medicine for dealing with tiredness in leaky gut syndrome. Califas offers much help in treating tiredness in leaky gut syndrome, hence of great use in chronic fatigue syndrome. The individual needing Califas feel very weak, tired, and prostrated. The present on both mental and physical level, there may be weight loss, and along with the fatigue, Califas is very helpful individual where extreme stress and worries have been linked with leaky gut syndrome. Such person may also have some sort of depression and sadness and gloominess. So Califas we are used in 6C, 12C, 6X, 12X, 30C, 30C, 200C, 1M, 1M according to the patient condition. So 10th remedy is arsenic album. Arsenic album, homeopathic remedy for asthmatic condition from leaky gut syndrome. Homeopathic remedy arsenic album is a well indicated for persons having asthma in leaky gut syndrome. For arsenic album to be used, the symptoms and episode of difficulty in breathing, in air passage, wheezing, and suffocation and cough attend above feathers. There may be mainly frothy yellow or green, mostly in sonity and thick. The asthmatic attack mainly arose after midnight. The asthmatic spells are attended with fear of laying down due to the suffocation, with respiratory troubles or marked anxiety and restlessness may be present in the high degree. So we are use arsenic album in 30C, 200C, and 1M according to the patient condition. So next remedy is Merxol. Next remedy is Merxol for watery stool with blood and mucus in leaky gut syndrome. Merxol is a top level homeopathic remedy for watery stool with blood and mucus. Hence, its use can be made in ulcerative colitis in persons having leaky gut. Leaky gut syndrome, for Merck salt to be used, these symptoms may be present along with watery stool containing blood and mucus. There is marked tenderness of the rectum. The person always has a constant urge for stool. The stool is native, watery, and may have undigested food particles. While passing stool, a cutting leaky pain may be felt in the abdomen. The stool may also smell. Sore weakness may appear after passing stool. A never get done sensation for stool always remain. Or marked chilliness may assist the above said symptoms. So Merxol we are used in 6C, 30C, 200C, 1M according to the patient condition. So next we are talk about some stomach related and digestion problems. Stomach and digestive problems spare no person at time. The stomach disorder is of a short duration and at other time long. Both stomach and digestive problem indicate that there is a something inherently out of order and the body needs immediate help. The discomfort and occupies stomach and digestive problem can hinder life activities and become embarrassment to homeopathic has a cure for both stomach and digestive problems. The natural homeopathic remedies for stomach and digestive issues. So first remedy is Nux vomica for stomach problems. Nux vomica is of great help in the treatment of various stomach problems. It is the best homeopathic remedy for heartburn that occur after taking coffee, spicy food, or alcohol drink. Nux vomica is also the ideal homeopathic remedy for constipation. Using this remedy for constipation, the prominent indicating symptoms in the constant urge to pass stool or poop, but the stool insufficient and unsatisfactory. Uh, Nux vomica is also used to relieve the heaviness and sensation of weight in the stomach after eating. So we are use Nux vomica in 30C and 200C and 1M according to the patient condition. So next remedy is Pulsatilla nigra. Next remedy is Pulsatilla nigra for gastric problems after eating fatty food. Pulsatilla is the best homeopathic remedy to deal with the gastric problems that arise as a result of consuming fatty food like parasites, ice cream, ghee and butter. Most of the patients requiring this remedy have a complete absence of thirst. Homeopathic remedy pulsatilla can also be used for treatment of loose stool. The prominent symptoms to use this medicine in case of loose stool in the changing nature of stool, if every time it is passed, chilliness also occupies loose stool. So pulsatilla nigra we are using 6C, 12C, 30C, 200C and 1M according to the patient condition. So next remedy is China. China homeopathic remedy for letting out gas from bloated abdomen. China is the most sufficient homeopathic remedy to relieve the bloated abdomen where the whole abdomen is full of gas. The gas may also cause severe pain in the abdomen. China is also the ideal homeopathic remedy for diarrhea with extreme weakness. Diarrhea to eating fruits can be very effectively treated with the with this homeopathic remedy. We are used China in 6C, China 12C, China 30C, China 200, according to the patient condition. So next remedy, arsenic album. Top homeopathic remedy for gastric trouble after food poisoning. Arsenic album is the best homeopathic remedy for gastric troubles that occur as a result of food poisoning. The patient requiring the homeopathic treatment for arsenic have the symptoms of nausea, vomiting, loose stool, and stomach pain. These complaints get worse after eating or drinking anything. The patient also feel an extreme burning sensation in stomach. So we are use arsenic album in 6C, in 12C, in 30C, 200C, and 1M according to the patient condition. So next remedy is lycopodium for stomach feeling full after eating very little. Homeopathic remedy lycopodium is an ideal remedy when the stomach feels full and there is a distension of abdomen. Even after eating very little, there is a rolling of gas in stomach with bumps that cause burning in the throat. Lycopodium is even the homeopathic cure for acidity due to intake of snatty. The patient requiring this homeopathic medicine at time also show as a craving for hot drinks. So we are use this remedy Lycopodium 6C, Lycopodium 12C, 30C, 200C, and 1M. So next remedy is Robinia, Robinia, Robinia. Homeopathic remedy Robinia proved to be an effective treatment for digestive disorder when patient complains of heartburn and burps that causing burning in throat and acidic vomiting. So we are use this remedy in 6C, 12C, and 30C and 200C according to the patient condition. So next remedy, natrum fast is recommended for the homeopathic treatment of heartburn with sore burps and sore vomiting. So we are use natrum fast 6x, natrum fast 12x, 30C, and 200C according to the patient condition. So next remedy is colocynthis. Colocynthis is mainly used for the treatment of cramping type of stomach pains. The patient requiring this medicine usually gets relief from pressure or bending double. So we are use this remedy in 30C, 200C, and 1M according to the patient condition. So next remedy is magnesia fast, magnesia phosphoricum. Magnesia fast is an ideal remedy for stomach pain of various kinds like cutting, sharp, cramping, or shooting pains. Application of warmth on the stomach soothes the stomach itch most of the time in patient requiring magnesia fast. So we are use magnesia fast in 6x, in 12x, in 30C, and 200C according to the patient condition. So next remedy is epicac. Epicac is a natural homeopathic remedy that can be taken by all the patients who have extreme nausea feeling. The nausea can be present alone or in addition to any gastric complaint. So we are use this remedy in 30C and 200C according to the patient condition. So next remedy is bryonia. Bryonia can be used in all those cases of constipation where the stool is very hard and dry. So we are use bryonia in 30C, bryonia in 200C. Bryonia in 1x, bryonia in 2x, bryonia 30C, bryonia 6C, bryonia 12C, bryonia 30C, and bryonia 200C according to the patient condition. Now I want to share some protocol which we are used in our clinical practice.
Dr. Imran, did we lose you?
Hello, everyone hear me?
Okay, there you are.
Okay. So first, my protocol is CCL. CCL. Carboveg 30C, China 30C, Lycopodium 30C. Mix together these three remedies and use 3 times a day. This protocol I use for a gastric pain or whole abdominal gas. Next protocol is for stomach pain. Nux vomica 30C, Nux vomica 30C, Epicac 30C, and arsenic album 30C. Mix together these three remedies and use 3 times a day.
Dr. Imran, I have a very quick question about these three. The stomach pain, does it matter where it is in the abdominal cavity, in the upper or the lower? You could use it for any part of the
Okay,
pain.
okay, okay. Let me explain first. So stomach pain, upper stomach pain. Now I want to share a protocol for lower abdomen pain. Nux vomica 30C, Belladonna 30C, Magnesia fast 30C, and Colocynthis 30C. Mix together these 4 MDs and use every 10 minutes until pain gone.
Can
Well,
you repeat
So this
that?
protocol, Nux vomica 30C, Belladonna 30C, Magnesia fast 30C, and Colocynthis 30C. Mix together these 4 MDs and use every 30 minutes until pain cure. This protocol we are used for lower abdomen pain.
You said for lower abdominal pain?
Yes. So next protocol is in the biochemic cell salts, ferrum fast 6x, kali Muir 6x, and magnesia fast 6x. Mix together these three biochemic cell salts in half cup of warm water and take 1 teaspoon every 5 minutes until pain gone. This protocol we are also use lower abdomen pain and upper abdomen pain and lower abdomen pain. So my next protocol is abdominal pain with nausea and vomiting. Abdominal pain with nausea and vomiting. Croton tag 30C, Epicac 30C, Carbovig 30C, and Bacteria 30C. I repeat again, Croton tag 30C, Epicac 30C, Carbovig 30C, and Bacteria 30C. Mix together these 4 MDs and use every 30 minutes until pain gone.
Could you repeat that again, please?
Okay. Croton tag 30C, Epicac 30C, Carbovig 30C, and Bacteria 30C. Let me write in comment box. Mix together these 4 MDs and use every 30 minutes until pain gone. So my next protocol is for stomach ulcer. Next protocol is for stomach ulcer. Arsenic album 30C, belladonna 30C, and colocynthis 30C. Mix together these 3 remedies and use 3 times a day. Next protocol is for stomach ulcer. If stomach ulcer
Is this
next
the
protocol
second one?
is sorry,
Is this
third
the
protocol.
second one?
Second protocol is for stomach ulcer.
The last one you gave us was stomach ulcers. Are you giving us another one for stomach ulcers?
Yes.
Okay.
Another protocol we are use for if stomach ulcer and also blood come with stool due to stomach ulcer. So protocol is colocynthis, 30C, phosphorus 30C, and magphos 30C. Mix together these 3 remedies and use 3 times a day. Second line protocol is Iris verse 30C, Arnica 30C, and Kali iodide kali iodide 30C, mix together these three remedies and use 3 times a day.
What was the one before arnica?
I write kali iodide.
Iris versicolor. Iris ver.
Hi, everybody. Happy New Year.
Hi, Happy New Year. So one more protocol is for stomach cancer. Cariazotum 30C and conium mac 30C, mix together these two remedies and use 3 times a day. So this one is a first line protocol.
What was the first remedy?
Cariazotum.
Can you write that down?
How many times a day?
3 times a day. So anyone have a question about this topic? So I'm here to answer.
Dr. Imran, someone asked a question in the chat. They are asking for a remedy for severe gastritis.
Magfast 30C, Colosenthis 30C, and Nux vomica 30C, mix together these three remedies and use 3 times a day.
Sorry, the protocol, the conium with creosetum. What protocol is this?
This protocol is used for stomach cancer.
Thank you.
If anyone want to ask a question, please turn on your mic and ask the question.
I have a question regarding acid reflux that goes up and affects the esophagus for like Barrett's problem with the esophagus?
Okay, so we are use a Carbovage 30C, China 30C, and Lycopodium 30C. Mix together these three remedies and use 3 times a day. And second line protocol is Ferrum Fast 6x, Natrum Fast 6x, and Magnesia Fast 6x. Mix together these 3 cell salts and use 3 times a day.
Thank you.
Always welcome, dear.
Dr. Emmerich, I'd like to ask a question, please. After antibiotic use, a round of antibiotics, severe reflux was developed and in turn causes, when the heartburn reacts, it's causing atrial fibrillation. Is there anything that you can recommend for that, please?
So after use antibiotics or other allopathic medicines, so most of the time we are first suggest arsenic album 30C, Nux vomica 30C, arsenic album 30C, Nux vomica 30C, and Robinia 30C. Mix together these 3 remedies and use 3 times a day.
Thank you. Would any of that help? Would any of those directly stop the AFib, or is there something else that you could take as like an emergency type thing for the AFib when that happens?
If suddenly heartburn start, then you use these remedies. Repeat every 10 minutes, 1 dose.
Thank you.
Always welcome.
Dr. Imran, I have a question. This one that you just gave, Arsenicum album, Nux vomica, and Rubinia, is this good in general after antibiotic use?
Yes.
Okay, thank you. I also have another question in regards to constipation. You gave Bryonia as an option for constipation for very hard dry stool. Would this also work for someone who has mild constipation?
So severe constipation, we are use Bryonia in lower potencies like 1x, 2x, 3x, 30C, or 6C. So if mild, a minor constipation, then we are use just Nux vomica 30C.
Thank you.
Welcome. So anyone have a question? Anyone have a question about this topic?
Sure, I have another one. You mentioned after eating fatty foods like ice cream. What about stomach pain after sugar? Just like any kind of regular candies or anything that children might get into?
Okay, if a Lycopodium 30C, Lycopodium 30C. like candies, chocolates, or other sweet foods. So we are use Lycopodium 30C, 2 pellets 3 times a day.
Amazing. Thank you so much.
Welcome. So anyone have another question?
Yes, Dr. Imran, I have a question. What about after gallbladder removal surgery? Do all of these protocols still apply the same?
So if uh, gallbladder surgery, if gallbladder removed, then we are use uh, Colostrinum 30C, Lycopodium 30C. If acid reflux or heartburning, nausea, vomiting, so then we add additional arsenic album, epicac, antimonium crodum, Naxomica according to the symptoms. But colostrinum and lycopodium need to use regular.
Thank you.
When you
Welcome.
when you say use regular, do you mean like twice a day? Forever?
Once a day for few days, then stop, then again need to use. So 2-3 week take and then stop for 2-3 weeks, then again start. So anyone have another question?
What's the conium and creosotum used for? Stomach cancer, you said?
Yes, stomach cancer. This is a
Okay.
first line protocol.
And is it so people should use for extended periods of time, isn't it?
So this is a first line protocol. We start with twice a day,
Mm-hmm.
and maybe the patient need another remedies according to the patient, according to the symptoms. If nausea, vomiting, then we need to add arsenic album. If lower abdomen pain, then we need to add magnesia fast, colocynthis. If blood come with stool, then we need to add hydrastis, phosphorus.
Mm.
But this protocol, we need to start with a first line protocol, conium and cariazotum.
Thank you. Thank you.
Okay, welcome. So now I want to say thanks to everyone. So next Sunday we are meet again with new topic, same time, and thank you very much. God bless you, everyone.
Thank you. Did
Thank you, Dr. Imran.
the meeting started only 15 minutes ago, or I miss some of the meeting?
I think you missed.
So what time did you start today? How long?
Today, I think we start 1 hour before.
An hour before. Okay. Okay. Yes. Thank you. Thank you.
You're welcome, dear.
Yes.
Have a good day and God bless you.
Yes.
Thank
You
you.
too. You too. Thank you, Dr. Imran.
Okay, welcome.